Hey guys, Dr. Jason Tirado here, your West New York chiropractor, and today I'm going to be talking about lower back pain, right? Well, of course, we're going to talk about lower back pain, right? Because that's what inflicts so many people in the world today. You know, most doctors and researchers actually believe that lower back pain can come from either the discs inside here, it can come from the bones inside here, it can come from the joints inside there, and really there are just so many variables when it comes to the source of actual lower back pain. But I'm only going to talk about two types of lower back pain. Mechanical lower back pain, right, inside the joints, and I'm also going to talk about low back pain that occurs from the nerves that come out of the joints inside here. And the reason being is because that's probably the most commonly type of lower back pain that I see inside my office. You know, so let's talk about mechanical low back pain, and that's the type of pain that comes from things like sprains, strains, facet problems, and even more. And the main difference between, let's say, between this mechanical low back pain and nerve root low back pain is obviously the absence of this nerve inside here being pinched. Therefore, when you have mechanical low back pain, pain does not radiate into the legs, and it very, very rarely even goes past the knee. So think about that. If you got pain that goes down, doesn't go past the knee, you might not have a pinched nerve, all right? And it doesn't even cause weakness inside the legs. So the mechanism usually with mechanical low back pain, it usually occurs when somebody kind of overdoes it. You know what I mean? Like maybe the person was shoveling too long, or maybe a person was just in an awkward position for too long of a time. Maybe they overbend or they overtwist. What else? You know, those types of movements that you happen, let's say you're changing a flat tire. However, lower back pain really can also occur for absolutely no reason whatsoever. That's what most people think, but I think in most cases during my consultations with people, I found that if I kind of nudge them a little bit to think enough, they usually can identify some type of an accident or maybe some type of a series of micro trauma, usually common with a lot of people that work at a desk, extending back in time that may be the actual cause of their current low back pain or what actually brings them inside my office. Now, nerve root lower back pain, right? That's where the nerve gets pinched inside there. It's a lot less common. And it's often, but the problem is it's often more severe. And it's simply because the pain that's associated with a pinched nerve is often very, very sharp. It's very extreme, and it really, really hurts. It even burns. And it also shoots down into the leg, into the foot, and even inside the big toe. And it's this type of pain that can cause numbness and tingling, can even cause muscle weakness. So the location of the weakness really, really depends upon which nerve inside the spine is being pinched. So I want you to think of it like a wire, right, that goes to a light. And the switch of the nerve is located inside the back, inside the spine, where it exits the spine, right? And when the switch inside the spine is turned on, that means the nerve is pinched, right? And then the light turns on, possibly in, let's say, your outer foot, or maybe your inner foot, or maybe in the middle part of your foot, or maybe in the side of the thigh, or maybe in the outside of the thigh. In fact, there are 7 nerves inside the spine and that run into our leg. So usually a very, very specific location will light up inside the leg depending upon what nerve is being injured inside the spine. So here's the bottom line. You know, when my patients present with some type of a lower back pain, I've been trained to look for these types of, let's say, less common but very, very important causes of lower back pain. And it's very important you get the right diagnosis, right? Otherwise, you might treat something that you might not need treatment for. Here's the bottom line. If you've been in back pain and you're considering, let's say, going to a doctor or a chiropractor, I realize that you have a choice in whom you consider for actually taking care of you. And I sincerely just appreciate your trust in choosing me or my staff for your needs. You know, if you or a friend or a family member, usually if you require some type of care for your back pain, it would be my honor, absolutely my honor, to help you or your family member or a loved one. So I just want you to give me a call. I've got a 24-hour service. They answer the phone and then they send the messages over to me. So we're always there for you. I'm Dr. Jason Tirado, your West New York chiropractor, and I'll see you soon.